Well, oftentimes when we hear people talk about going on strike, it's because they want a bigger paycheck. But that is not the case with 12,000 nurses in the Twin Cities. They say their big concern is patient care. They say they are stretched too thin and assigned too many patients. Last Thursday, these nurses came together to rally in support of a new contract. The nurses who want a new contract work at North Memorial, Health East, Alina Methodist, Children's, and Fairview. Hospital officials say some of these nurses have been misinformed about what the new contract entails. Joining me now to talk about the possibility of a strike is John Nemo, the spokesperson for the Minnesota Nurses Association. Thank you so much for coming in.
Thank you.
I have talked to a number of nurses that I know, and every one of them thinks that there's going to be a strike. What do you have to say about that?
Well, I think it's never a case where the nurses want to go on strike. I think it's a case where the hospitals are going to force nurses on strike. I'll just give you one quick example. They literally, in 6 weeks of negotiations, have not responded to one proposal from the nurses.
All right. The vote is May 19th. We should know that evening, and the strike would happen June 1st.
Around the beginning of June, yep.
All right. What are some of the key issues? The hospitals want to be able to float a nurse from floor to floor. What's wrong with that?
Well, it's the hospital's idea is that nurses are almost like widgets. Like a nurse is a nurse is a nurse. But they're human beings that are assigned to specific places, specific duties. It's essentially, if I said to you, Esme, I'm going to call you 90 minutes before your shift here at CCO. I'm going to send you over to Care 11 to do the sports report on the Timberwolves. I mean, is that necessarily a safe thing? You know what I mean? It's essentially with nurses, what they're going to do is say, I'm going to take a nurse from the NICU and send her over to a surgery floor at a hospital she doesn't work at and doesn't know the patients, doesn't know the doctors.
All right. Another issue is the canceling of shifts. Right now, the hospitals can cancel 3 shifts. The hospitals want to be able to cancel 15. Explain what's going on there.
Essentially, what the hospitals want to do is say they want to have their nurses take 3 weeks a year or more unpaid. And so I don't know many working Minnesotans that could afford to have almost a month of pay taken away at the whim of your employer. And so that's something that's dramatically changed. Our nurses have already saved these hospitals tens of millions of dollars doing this already, voluntarily. And now the hospitals are trying to capitalize on the nurses being giving people by forcing them.
All right, although many people out there, many workers out there have had to take furloughs in other jobs and other positions. Absolutely. As a result of this economy.
Yes, and nurses will continue to do their part, and these negotiations are not about the economics. They're really about you, about anyone that goes through the doors of a Twin Cities hospital. Okay.
You know, I'm sure there are people out there listening who may be expecting a child, you know, June 5th. It appears that the hospitals have about 2,000 replacements lined up. Those replacements will be paid triple what nurses get. Are the nurses at all concerned about what's going to happen if there is a strike? I mean, how can 2,000 temporary workers replace what 12,000 workers do here?
Well, they can't. They can't. The hospitals are going to operate at half capacity or less. They're bringing in nurses from across the country that aren't familiar with the Twin Cities hospitals, their systems, their patients. They're paying them triple rate to kind of come in as strike breakers. And, you know, frankly, the last strike out in Philadelphia at Temple, there were hundreds and hundreds of complaints from patients about the nursing care. One gentleman even walked out of the ER to the picket line to ask the nurses there for help. So it's a serious game. It's no laughing matter, and our nurses do not want to leave their patients. They do not want to have to strike.
All right. Well, John Nemo, we obviously are going to be following this story closely. Thank you so much for coming in.
You bet.
Right. We should tell you that hospitals in the Twin Cities say they are ready to hire those temporary workers if a strike takes place.